morning, everyone.
Good morning.
Good morning, everyone. It is so inspiring to be with all of you this morning. So heartwarming, and I'm so grateful for the expertise and the passion and all of the ways, the many, many ways that all of you are helping people in our state and beyond. We are very honored to be here with you today. My name is Joanne Rosen. I'm the Chief Public Affairs Officer at Samaritan. I'm here with my colleague, Erika Thomas, that you will hear from Erika in just a moment. I'm just going to set the stage and talk to you a little bit about Samaritan and who we are, only to provide context for Erika's talk and our expansion to social connections and making an impact in Southern New Jersey for people who are isolated and lonely in collaboration with our community partners. So Samaritan is a not-for-profit community-based healthcare provider founded way back in 1980 as one of the country's very first hospices. Grassroots effort by a group of volunteers from across sectors in the community who wanted to provide a more compassionate, respectful way to help people have a quality of life as they were transitioning to the end of life in their final months. So many people know Samaritan for hospice, but based on the needs of our community and what we see among patients, family members, caregivers, and others, we have expanded our services very significantly over the last 44 years to serve people in many different ways with the resources and the infrastructure and expertise and passion for helping that our Samaritan team brings to our patients and families. So we have a couple physician practices under the Samaritan umbrella so that we can help people upstream in the healthcare continuum, not just at end of life. So our palliative medical partners physician specialty practice is addressing pain, symptoms, stress of serious illness at any stage. Some people think that palliative care is only end-of-life care, but it can be helpful for anybody with a serious illness from the time of diagnosis through treatments and beyond. Hospice is a form of palliative care limited to the last 6 months of someone's life. We also have our Center for Grief Support so that we recognize the impact of grief on the caregivers and family members we serve, but also anybody in the community who's grieving the loss of a loved one. Our home visit physician practice provides the full range of primary care services for older adults who can't get out to see their own physicians. And this has been so well received and another growing practice for Samaritan. Again, providing full range of primary care for people who can't get out. And because of the services that we provide, the patients and families that we see, we recognize that so many of the people we serve and so many of the people in our region that we don't serve yet are also impacted by social isolation and loneliness. So we launched our social connections programming almost 2 years ago, and you'll hear more about that from Erika. One last thing, we are really committed to education and advocacy through our Boccolini Institute for Education, Research, Innovation, and we love to partner, as you'll hear from Erika. So just providing that context of who we are. And now I'm going to turn it over to my esteemed colleague, Erika Thomas.
Good morning. My name is Erika Thomas. I am the Director of Social Connections here for Samaritan. I develop programs aimed to advance social connections. As Joanne stated, our programs began with about 2 years ago. We partner our volunteers with some of our patients here in our different programs that we offer, just to assist with their challenges dealing with the social isolation and loneliness. I don't think that it's a surprise to many of us since COVID and the pandemic that the numbers have skyrocketed for social isolation and loneliness. The Surgeon General actually recently put out an advisory emphasizing that our relationships are essential to our health and well-being. And that's something that we're using just to kind of steer us in the right direction with impacting this health crisis. So I have here just some data. The data shows that social isolation is not new to us, but it's definitely emerging as a health crisis, as I stated. In the advisory that the U.S. Surgeon General put out in 2023, it discussed the 6 pillars to advance social connection, strengthening the social infrastructure, in communities, enacting pro-connection public policies, mobilizing the health sector, reform to digital environments, deepening our knowledge, and cultivating our culture of connection. We have just some numbers that demonstrate the impact on various different types of impact, that social isolation and loneliness, disconnectedness has in our lives. The physical health aspect, just showing that it increases the mortality rate, cardiovascular disease, type 2 diabetes. We have depression and anxiety, suicidality, addiction. It affects cognitive health with cognitive decline. We're seeing an increase in dementia, Alzheimer's disease, and then there's the economic health aspect also. So some of the programs that we've developed to help with these issues and these challenges, we have our Friendly Call and our Friendly Visitor programs, and those programs are where we've matched our volunteers with our patients. We have volunteers that will call our patients on a weekly basis. The calls last anywhere from a few minutes to some are even a couple of hours. These patients and these volunteers develop relationships, friendships, and eventually they turn into friendly visitors. So these callers have now kind of merged into the Friendly Visitor program where they are determining that they want to meet up and have coffee and kind of continue that friendship. We also have our Robotic Companion Pet program. As you can see in the pictures, it's a very successful program. We've seen the success really with a lot of our dementia patients. We have our patients that have named their pets. They really have just brought a lot of life and a lot of just love and companionship to these patients' lives. We've actually just recently opened up these programs to our caregivers also. We've noticed that it's not just the patients that are suffering with the social isolation and loneliness, the feeling disconnected. Our caregivers also are very disconnected from socialization with peers, with friends, with family members. So we've opened these programs up to our caregivers as well. We have some programs in development, just that we're, again, expanding to the community. We have an intergenerational program that is in the works, as well as connection cafes. We're looking to have programs where our caregivers can connect together. Nobody understands the life of a caregiver outside of a caregiver better than a caregiver. And then we want to look into a chat app where people can connect utilizing social media. It's a very common practice these days to communicate that way. So we want to join in on that and see if that can be a flourishing program for us as well. So one big, very important thing that we're doing also is that we are a member of the National Coalition to End Social Isolation and Loneliness. This coalition meets regularly. We're also a part of the steering committee and the older adults work group. We just kind of discussed various ways, right, that we can work together to impact this health crisis. We share ideas. We discuss programs that we have across the board to different amongst our different populations. And then most recently, in November of last year, actually, we had our first convening of Southern New Jersey community leaders. It was a collaboration of community partners where we had people who serve various vulnerable populations in our area, the Southern New Jersey area. We have representation from older adults groups, veteran groups, youth groups, groups that serve people with disabilities, the LGBTQ plus communities, and various others. We met recently, actually this week, Tuesday, we met again for our second convening. It was larger than the first, and we plan to continue to grow. We're in these convenings, again, we discuss what social isolation and loneliness looks like within our various communities and how we can develop programs and partnerships to help each other out. We're utilizing the action guide for building socially connected communities. This action guide was created by 4 different organizations: the Foundation for Social Connection, who we work with pretty closely, the Einhorn Collaborative, Healthy Places by Design, and the Human Flourishing Program. Here is our contact information. We have a Facebook page, Twitter, I think now known as X, and Instagram. I also have my email address and my office phone number on here if you would like to reach out with any additional questions, suggestions, partnerships. We are open to it all.
Erika, hi, it's Emily from Rutgers. It's nice to meet you here.
Hi, Emily. How are you?
We've had a lot of email exchanges, but not the opportunity to cross paths in Zoom in person. Nice to see you. So I wonder if maybe if you're able to stop sharing the screen so we can see each other, and if others want to if you're able to turn your cameras on so we can connect on the thing. Yeah. I don't know if others have comments or questions. Reflections?
Now, I just wanted to say this is a lot of good information to have because my mother I went through Samaritan House with my mother when she was diagnosed and had end-stage liver disease. And one of the things that they did provide for her was the in-home care. And that was very appreciative. And it was also, I mean, I would never be able to have done the things that they did for her in coming here because she adapted well. As her caregiver, she adapted well to the people who came. And it was refreshing to see her light up when they came, from the visiting nurses to the therapist. And I think that these additional programs I was not aware of at the time. But I do appreciate knowing that they exist, and I will be able to help others that are in that situation by giving them the information I learned today. So I just like to say thank you.
Thank you so much. We appreciate that.
I want to give you guys kudos. I was at the Wednesday convening and it was amazing, and I strongly recommend joining and reaching out to Erika if you would like to be a member. I drove an hour and a half and it was each way, and it was it was so worth my time, and the access to the speakers from Social Foundation for Care is added, Jerry, and the state of New Jersey, and of course Erika, and all of the participants. It was rich. The conversation was enlightening, and yeah, I feel so much more connected and better able to steer my residents. We have I work at a nonprofit housing company. We are mission driven and have approximately 1,200 units in New Jersey and Pennsylvania, most being for seniors. And we also offer Homeless Preference. It's a very, very generous nonprofit. And yeah, I'm going to be talking about social isolation and loneliness in Atlantic City on May 2nd at the JAMA conference. So I hope you guys will come and join me on Thursday morning. And if you don't, I'm happy to share any information. And Erika is my mentor.
Thank you so much, Jane.
And there's other people up here that were there, so maybe give them just a general shout out.
Dave, I see your hand is up.
Yeah, I just wanted to thank the presenters for a very informative presentation. The conference has been great. I am a professor at Stockton, and technology and aging is one of my specialties. Many years ago, 25, I think, I was the co-convener of the Gerontological Society's formal interest group on technology and aging. And I got to have one of these robotic cats in my hand in a session that I had created. And it was like the first prototype, professors from Carnegie Mellon, I believe. So it's really neat to see you're using them effectively in the community. They can be so useful to calm an elder with dementia, for example. So yeah, it put a smile on my face. I'd rather have a real cat, but sometimes that's not practical. And the robotic pets have been developed over the years. So it's really cool to see you using them.
Yes, they're amazing. We actually, some of our social workers have recently been requesting them to see if they'll help also with the challenging behaviors that can happen.
Yeah.
So we're kind of piloting that now to see how that's working.
And from some of you from South Jersey, you may remember, like our Atlantic County Office on Aging years ago as well, would give out pet parakeets, thinking that elders were more able to care for a bird than, a cat or a dog. But I haven't seen that program in a while.
I just want to also thank, there's a couple of other members in this breakout that were at our convening. It's good to see you all. Marilyn and Darlene.
Yeah, good to see Marilyn. Yeah.
There was another question about our intergenerational program. So we are piloting the program currently where we're going to match we're looking to match high school aged and or younger adults. I have several ideas of how I want to kind of how I want them to engage with the older population, but what we plan to do is provide an interest survey to find what exactly it is that they would prefer to have, whether it's a technological skill they learn, something with telecommunications, a way to communicate with their children, grandchildren, great-grandchildren. There's so many different social medias and ways to communicate now. We want to provide kind of a skill-based program. We also are looking to do a program with a legacy program. So we have various ideas, but the pilot will be, we have, I think, 3 young men right now that are interested in helping us with matching them up with some older adults. So that's where we're going to start.
Okay. Hi, everyone. I have a brief question. Karen Zerlo from Rutgers University. And, I appreciate what you shared about your social connections program. I think it's so critical given the really adverse consequences of being isolated and alone as an older adult. But in some of my work in New Jersey, an issue that's been raised is lack of transportation. And I'm just wondering if that's a topic area that interests your organization. And if it is, how can we better advocate for more transportation for seniors?
It's definitely a large hurdle, I will say, especially with our, like, for instance, the Connection Cafe program. One hurdle that we've already come across is how will people get here or get to wherever the location is. So it's been encouraged to do more of a virtual cafe connection to start, but it is an issue. And I believe if we did not have anybody at the convening from the Department of Transportation, it is definitely a goal to include them in our future convening sessions, for sure.
Thank you so much.
So I'll ask a question. So our team, our research team at the Rutgers Have Aging Collaboration does a lot of work on age-friendly community initiatives. And through that, we've learned the power of trying to change hearts and minds around municipal leadership for better addressing the aging of their population. And it's interesting, like we've had some of the initiatives in our region started as more than one town doing an age-friendly initiative. And we thought that would be great because it's really great when you have multiple towns working together, shared services, efficiencies, that every little tiny town doesn't necessarily need their whole big age-friendly thing. But what we learned over time, actually in experience, is that it actually it's hard. There's challenges to having, you know, different jurisdictions have accountability and shared ownership over something that people are really kind of psychologically wedded to their own elected body and their own manager. And so I'm just wondering, in terms of this amazing multi-county initiative, just kind of thinking about the multi-level systems considerations, and especially like so many people connect through their immediate life space, like in their own little locality, how you're thinking about strategically doing this coordinated regional initiative, but then having that translate into like a more hyper local implementation or social change model.
So I think the start to that would be with the steering committee. I think with our steering committee, we also plan to have various work groups developed. And I think that'll help kind of break it down to us, to each various population, different areas. I think that's our initial start of a plan, how we'll address it that way.
Emily, I think that's interesting that you bring that up. I'm with Interfaith Caregivers of Greater Mercer County, and we do go a little bit to the outskirts of Mercer. We go a little bit into Burlington, a little bit into Middlesex. But it is a real challenge because we're a volunteer-led organization that matches volunteers with older adults to go to their homes and help with transportation or grocery shopping or things like that. But our volunteers are also tend to be over the age of 65, and they don't want to travel great distances, and there's a lot of challenge with that. That we're a local organization, yet we want to help as many people as we can, yet our volunteers want to stay local. So I think that's interesting that you bring that up as a point. And Erika, I'm going to be reaching out to you actually, because I want to see if maybe we can coordinate and collaborate in some way, maybe to expand both of our reach.
That's great. I look forward to it.
Thank you for this presentation.
Checking the chat.
Can you,
Erika.
Erika and Ellen, put your email addresses in the chat if you don't mind? Thank you.
Absolutely.
Erika, can you talk about where the pets came from? Your pets at Samaritan?
The company is Joy for All Pets, I believe. I will say you can find them in other ways to purchase them, but we bought them directly from the company.
Thank you.
Mm-hmm. I actually intended to bring one, and I did forget to bring one into this meeting space today.
We'll just have to do it again sometime. I'd love to see it. Yeah, it's interesting too. I mean, just from my vantage point, again, around age-friendly community initiatives, it seems so similar to this work in terms of like the multi-sector collaboration and kind of doing assessments and finding strengths and where can we improve and who's going to do what, like coordinated action. Just a heads up for colleagues who are doing work in Southern New Jersey in particular, there's, a forthcoming announcement from the New Jersey Department of Human Services for grants from the state to local communities who want to make age-friendly progress. And I feel like the the networks you're building around social isolation are just so important for readiness for communities to be able to bring those resources into their communities, and also think about how some communities are really sparked by aging, for example. Others might be sparked more by like youth mental health. Others might be sparked by social isolation kind of broadly. So just kind of giving communities a lot of on-ramps for how they want to address these cross-cutting issues. I don't know in your work already, and we have a minute left, if you've seen those pieces, kind of like people being able to connect those dots, or people kind of really coming in with their particular populations in mind, entering into conversations on social isolation and loneliness.
Yeah, at the convening, I mean, it was honestly amazing to watch populations that you wouldn't typically see develop partnerships. We had a really great organization, Project Refit, and they were connecting with multiple different sectors. It was amazing to watch. It really was. We had physicians there from Jefferson, from Virtua, who were connecting with different people. So we had, discussions about new mothers, which is not, a population that's commonly spoken about. So it was really great to watch all those partnerships being made.
Hi, this is Marilyn. I just wanted to make a comment. First of all, I want to echo what Jane said about the convening. It was amazing. It was terrific to make those connections. Erika, the presentation was very eye-opening, how social loneliness and isolation is cutting across various generations. I think that looking at intergenerational work, in which the way, we often think of people helping older adults, but we don't often think of the ways in which older adults can help other generations, and the kind of life experiences and gifts and skills that they bring. So it's sort of like a reciprocal relationship, right? Older adults helping younger people help adults. And it was helpful at the convening to have a bunch of thought leaders who have taken some time to consider how we can not only reach across systems and programs, but reach across generations to address social isolation as a whole, which has become a major public health issue and a societal issue. The energy in that room was palpable. So thank you to Samaritan